Good morning, everyone. I believe we're about to get started. Right. Good morning, Minister of Health, Wellness and the Environment, Antigua and Barbuda, the Honorable Malwin Joseph, distinguished panelists, members of the UN agencies, media, and other key stakeholders joining us live at the Accra Beach Hotel, Barbados. Of course, warm welcome to those of you joining us virtually as well. Welcome to today's press conference, which focuses on the communication campaign organized by the UN agencies in the Eastern Caribbean in collaboration with Trend Media Group Digicel. This campaign, entitled Leveraging Digital Technology to Promote COVID-19 Vaccine Uptake, sees the joint efforts of these two stakeholders to support countries to tackle vaccine hesitancy related to COVID-19. From October 2021 to January 2022, the Pan American Health Organization, PAHO, World Health Organization, WHO, and the International Telecommunications Union, ITU, of the UN, in collaboration with Trend Media Group Digicel, launched a public health communication initiative, leveraging mobile networks to deliver relevant and, most importantly, reliable health information directly to our customers' phones. The campaign was aimed at disseminating practical information about COVID-19 prevention, COVID-19 vaccines, and recommended health safety measures, and targeted 3 countries, namely Antigua and Barbuda, Grenada, and St. Lucia. During this press conference, we will share the results of these efforts, a brief on the UN Vaccine Hesitancy Project, as well as some reflections on how mobile health solutions can be further leveraged to address infodemic misinformation and disinformation, and overall help to achieve better health outcomes. A gentle reminder that all COVID-19 protocols are to be observed for the duration of this press conference and post-conference activities. As well, if you can please have all your mobile devices on silent. Without further ado, allow me to introduce our invited guests and esteemed panelists joining us today. We have from the UN Resident Coordinator, Barbados and the Eastern Caribbean, Mr. Didier Trebek. Mr. Trebek will be joining us virtually and you'll hear from him shortly. We have Dr. Yatedes Gabriel, PAHO-WHO representative for Barbados and the ECC. Mr. Cleveland Thomas, AVIR representative, ITU, International Telecommunication Union for Caribbean countries. While not joining us in person, but joining us virtually, we have Mr. Mark Corrigan, General Manager, Trend Media Group, Digicel. And joining us as part of the meeting would also be the Minister of Health, Wellness and Environment of Antigua and Barbuda, the Honorable Malwin Joseph. And last but by no means least, Dr. Darlene Omer, Family and Community Health Advisor, PAHO-WHO, Office of Barbados and the Eastern Caribbean. So having done the introductions and required salutations, let's kick things off with a pre-recorded address from the Resident Coordinator of Barbados and the Eastern Caribbean, Mr. Didier Trebek, addressing us on the critical importance of this initiative and specifically vaccine hesitancy and the UN initiative.
Ministers of government and government representatives, my colleagues, head of PAHO-WHO and ITU, the representative of Digicel, ladies and gentlemen, member of the media, good morning. It's truly my pleasure to welcome you all in today's press conference, which reaffirms the United Nations commitment to working with Eastern Caribbean countries and overseas territories to reduce vaccine hesitancy and ultimately to increase uptake of COVID-19 vaccines. Since the first confirmed case of COVID-19 in the Caribbean just about 2 years ago, our lives have changed in an unimaginable way. COVID has not only adversely impacted the region's socio-economic landscape, but it has also revolutionized the way in which we all interact, conduct our business, and engage socially. Studies indicate that vaccination remains a critical weapon in the fight to get back to normal. And I wish to personally commend ministers, development partners, and health professionals across the region for your tireless efforts to make vaccine accessible to all eligible segments of your populations. Despite the ready availability of vaccines, however, uptake has been slower than anticipated, with some countries falling far short of the WHO target set for the end of last year. It is doubtful whether this year's target of 70% of the population being fully vaccinated by June 2022 will be met. In some countries, fully vaccinated persons account for less than a third of their population. Consequently, this puts more individuals at risk of catching the virus and giving rise to new variants. It also directly impacts the region's ability to benefit from a much-needed economic rebound. Last November, in the spirit of cooperation and in consultation with regional governments, we as UN were very pleased to launch, along with several health ministers of the region, an interagency initiative to promote COVID-19 vaccine uptake and address vaccine hesitancy in Barbados and the Eastern Caribbean countries and territories. Over the past 4 months, the 6 participating agencies, namely PAHO and WHO, being the technical lead, UNICEF, UNDP, UN Women, ILO and ITU, have been partnering with regional governments to address vaccine hesitancy, for example, through the provision of policy support, behavioral change strategies to complement ongoing communications and advocacy, vaccine motivation, and strengthening, of course, vaccination campaigns rollout. This initiative has achieved notable results today. And thanks to a comprehensive vaccine hesitancy survey released a few weeks ago that was conducted in 5 countries, we now have greater insights into the underlying drivers of vaccine hesitancy. Other successes in this endeavor include the dissemination of a range of health communication content via a Choose to be Vaccinated regional campaign conducted by PAHO, UNICEF and ITU, the development of study on vaccination as a driver for socioeconomic recovery in Barbados and the Eastern Caribbean done by UNDP, and strengthening COVID-19 rollout and improving cold storage capacity in the region implemented by PAHO. I'm equally very pleased to share with you today that under this UN endeavor, PAHO, ITU and Digicel have joined forces to provide the residents of Antigua and Barbuda, Grenada, St. Lucia with targeted practical information on COVID-19 prevention and vaccination through short message services or SMS. This particular initiative, which you will also hear more about today morning, underscores the value of partnering with the private sector and in this case Digicel, who I thank for their partnerships, and other non-state actors to capitalize on expertise and technology. Ladies and gentlemen, the UN remains committed to such innovative partnerships. We also look forward to working with the media present here today to address vaccine hesitancy and better protect the most vulnerable so that no one is left behind in this pandemic. Thank you very much and wishing you a good event today.
Thank you. Having set the context, we now invite Dr. Yetades Cabre, PAHO WHO representative for Barbados and the ECC, to speak to the topic of moving from pandemic to recovery, the value of vaccination. Dr. Gabriel is an epidemiologist and preventative medicine specialist with 26 years of senior technical public health leadership and management experience. He has a proven track record of building capacity of country ministries of health at national and subnational levels, as well as local civil society organizations. He brings firsthand implementation experience at the community level to increase utilization of health services, eliminate barriers to access, and improving health outcomes of populations living in vulnerable situations. Dr. Cabre, the floor is yours for the next 5 minutes.
Thank you. When will the pandemic end? It will end when we choose to end it, because ultimately it is not a matter of chance, it is a matter of choice. There is no path out unless we achieve our shared target of vaccinating 70% of the population of every country that by the middle of this year. Protocol is observed. I will continue my presentation. Each hour, 300 persons have died of COVID-19 since the start of this pandemic. 5 million children were orphaned due to a loss of a father or a loss of a mother. This is not over. We have another task at hand. COVID-19, which is caused by Omicron, has affected all countries. It has affected schools, it has affected work, it has affected our daily living. As you know from the speech from the resident coordinator, why we have started this project was that we have a low COVID-19 vaccination uptake in all of the Eastern Caribbean countries as a result of vaccine hesitancy. At October 2021, the average vaccination coverage was about 30%. This would have also improved by about 41% by January this year. So you understand the gap. The misinformation, disinformation issues which was mentioned earlier are the potential for vaccine hesitancy, and the lack of information appropriate for the people may have been also the concern. So if we don't have vaccination to all who needs it at the time they needed it, definitely to also create vaccine-related, non-vaccinated related new variants of concern to continue to circulate in population. Next one. The issue is that 10 countries and territories in the Caribbean have not yet reached WHO 2021 goal of at least 40% by December. So we have to do more. Vaccine hesitancy is one of the lead problem. Lack of vaccination centers closer where people live, learn, and work, insufficient staff members, limited cold chain, and infrastructure may have also created this low coverage. We are very happy to work with our partners, and especially the private sector in this perspective. We have to do more, not only government to provide vaccination, but the private sector as well. In this perspective, our work would have showed whether the countries in the Eastern Caribbean would reach the 70% by June 2022. The next slides would show you the gap between now and June for at least few of the Eastern Caribbean countries, which may not be able to attain that 70%. Why 70%? Next one. 70% is a data which we are using as a proxy for herd immunity. That herd immunity is much better utilized if it is vaccine driven. However, individuals may have been infected. Close to 500 million people globally have been infected with COVID-19. That infection by itself is not sufficient to continue immunity. From this graph, you may be seeing that few countries in the Eastern Caribbean may be able to attain the 70%. I'm very pleased to say at least one of those countries could be Antigua and Barbuda, and the Minister of Health this morning is joining us. But there are other countries who were able to achieve by the end of this June 2022, the 70% mark. The next one, please. So in order to achieve this pandemic behind us and then end, and then to come back to certain level of comfort with activities, we need to have 70% of our population in every country, everywhere, to be vaccinated. We need also to reduce death through strong clinical management as it relates to antivirals and other treatment, oxygen in hospitals, and then have to have access to everybody. The third one is that boosting. We need to have boosters for those who may need it. And then also testing, sequencing of the virus, because we have to know when we have the new variants in our population. We have to calibrate the use of public health social measures. We cannot just open up our communities without knowing what is going on and when to also put back our social measures. Knowing also the most vulnerable not to be affected when we close down certain things. Finally, we have to restore sustainable essential health services. We cannot continue only providing care for COVID-19 when mothers are not able to be attended, people with diabetes or hypertension or other diseases, or HIV testing is not taking place in our health services. Last but not least, we have to learn critical lessons and defining new solutions. We don't have to wait for the next wave of new variant of concern to teach us a new lessons. We have all the tools. We have to stop the pandemic right now. I thank you very much.
Dr. Gabriel, and some key stats that you would have shared: 70% by June 2022, the importance of us not waiting, and of course, the critical tips for ending the pandemic and what it means for each and every one of us. So thank you once again, quite enlightening. Joining us next to address the topic of mobile health solutions in addressing vaccine hesitancy is Mr. Cleveland Thomas, Caribbean Regional Head of the UN's ITU. Prior to this appointment, Mr. Thomas was the CEO for the Trinidad and Tobago State Enterprise, iGovTT. After leaving the National Telecommunication Operator, TSTT, he held the post of National Chief Information Officer for the Government of Trinidad and Tobago. As the NCIO and the CEO, Mr. Thomas was charged with the responsibility to implement the government's ICT vision for development. He also has made presentations to government officials in Georgia, Russia, the Caribbean, Fiji, Botswana, Switzerland, and Zimbabwe, just to name a few. Mr. Thomas, over to you, sir.
Thank you. Good morning to you, all protocol observed. The International Telecommunications Union is the United Nations specialized agency for information and communication technologies, better known as ICTs. As you know, ICT in general and mobile and wireless technologies are already transforming the way we live and the way we work. Through a number of multi-stakeholder initiatives and collaborations with partners like WHO, PAHO, and UNICEF, we have been promoting the potential of ICTs for better healthcare worldwide. You have heard from the previous speaker, my colleague, concerning the hesitation as it relates to the COVID-19 vaccination. When the response to the COVID-19 pandemic was being hampered by an avalanche of misinformation, it retarded the vaccination efforts and potentially also increased the mental health issues that many of our youths and others were already facing. It was clear to us that additional agile methods of information dissemination were required to combat the infodemic. Internationally, the ITU and WHO set up what is known as the Be Healthy, Be Mobile initiative, where we work with governments to scale up targeted client communication, messages, services for NCDs and their risk factors. The program is functional in more than 12 countries that reach over 4 million people with better information on dementia, cervical cancer, tobacco cessation, diabetes, and much more. Due to our familiarity with the telecommunication landscape in the Caribbean region and our experiences in other parts of the world with the Be Healthy, Be Mobile initiative, it was a natural fit for us to apply this program to deal with the COVID-19 misinformation problem. What was needed ought to be quick, simple to understand and use, and reachable to a wider audience. And as you know, almost everyone in the Caribbean has a mobile phone, if not 2 phones. We utilize the short message service, SMS platform, as the primary method of communication, which was also linked to mobile application. At the end of the 8-week period of BLAST, over 12 million SMS messages were delivered to subscribers, reaching more than 95% of the population of the countries most challenged at the time. In these messages, we embedded additional links to videos, digital wraps focusing on key messages, supporting the vaccination campaign. Secure and reliable information, in fact, were provided for citizens to take safe action. Through the system and with a wider reach, there were better information, more accurate information that help users to make more informed decisions concerning their health. With technology, mobile and wireless in particular, we can improve information flow to and from between patients and their doctors. We also can have remote consultation, avoiding the need to travel or to take time off at work. Through mobile communication and with what we have done, we can also find improvement in the management of medical records. For example, through the ability for patients to carry their own record on their mobile phones. What are the lessons that we have learned through this collaboration? Undeniably, technology and the internet underscores the relevance and the potential of mobile solution to support the SDG attainment in the region. It would also help weather the challenges we face today, whether it's healthcare, education, business, transport, or any other part or aspect of our lives. Collaboration is critical, as we just heard from our colleague. Both the private sector, the government, and others must contribute to have a collective effort to solve some of these issues that we have. And we can reach the unreachable, including those in most remote areas. I want to end by thanking the collaborating agencies, PAHO, Trend Media, for the quick turnaround during the negotiations concerning the terms of this service. The regulators in all of the islands that participated, and the governments, and our colleagues at the ITU offices in Geneva, here in Barbados, and in St. Lucia, all who have taken that effort to make this a success. I want to thank you, and God bless you.
Thank you, Mr. Thomas. And again, just some quick highlights while I maneuver my mic, 1 second. And Mr. Thomas spoke about the potential of technology in support of sustainable development goals and dealing with challenges such as we face with COVID-19. And again, the importance of collaboration as we're seeing today, and of course with you, the media, and getting that message out in reaching the unreachable. And most importantly, those unreachable members of the population tend to be the most vulnerable. To hear more about the use of technology in bridging this divide, we invite Mr. Corrigan. Pardon me. So let's hear now from Mr. Corrigan, the General Manager of Trend Media Group, Digicel, to share some more details of the topic of digital technology and the reach of the campaign. Mr. Corrigan is no stranger to the digital space and has extensive knowledge of digital advertising, having worked with some of the largest global publishers and ad networks, including but not limited to the BBC, The Guardian, MSN, Yahoo, Outbrain, the Irish Times, Verizon Media, and multiple indigenous Irish publishers. Since moving to the Caribbean market, Mr. Corrigan and his team have been providing companies with performance marketing, creative solutions, and publisher alignment. Mr. Corrigan, the floor is yours.
Thank you very much. Good morning, everyone. So as you all know, there is a lot of misinformation and mixed messaging around COVID-19 vaccine rollout. So it is vital for organizations such as PAHO and ITU to be able to depend on reliable.
I think we're having a bit of a technical challenge. So if we can just give 1 second so we can hear the audio.
No problem.
I don't believe we're hearing Mr. Corrigan. So do bear with us for 1 second, please, Mark.
That's okay.
All right, let's try that again.
Okay, hopefully you can hear me. Good morning. Okay, just to jump into it again, I was just saying there that, as we all know, there's a lot of misinformation and a lot of mixed messaging around COVID-19 vaccination. So it's very, very important for organizations such as PAHO and ITU to be able to depend on reliable and established partners to help deliver on their communication objectives. So if we could jump to the next slide, please. Essentially, the role of Trend Media here was to help PAHO and ITU ensure that this very important messaging was amplified to the right people at the right time on the right medium. This is all fueled by first-party data that we have as part of Digicel. So essentially, our objectives were to help raise awareness, debunk myths, prove guidance, and have a very clear call to action. This was done on our SMS offering. We also aligned PAHO against Loop News, which is one of the biggest news platforms in the Caribbean. Loop News is owned and operated by Trend Media, and we were able to align their messaging to the audience that are on that website all day, every day, while they were searching for the latest news around COVID-19. If we jump to the next slide, please, we were able to send out over 2 million messages. This was representative of a unique number of 150,000 people. By implementing some various different technologies, such as Sender ID, we were able to ensure there was a certain level of trust and credibility to the people who are receiving these messages. And by having other ad measurement technology, we were able to track the engagement, which helped ensure the investment by PAHO and ITU was effective as possible and reduce wastage. So as I said, this number represented 150,000 unique people. 58,000 people clicked through, and then 10,000 people engaged with PAHO myth-busting and educating content. A lot of this is down to the very clear call to action. And over 1,500 people accessed resources on COVID-19 prevention. So if we just jump to the next slide, please, just to summarize, we can see here that over 2 million SMS messages were sent out, 150,000 unique people received messages from PAHO, raising awareness on all the various different elements we spoke about. 10,000 people watched PAHO myth-busting education videos, and over 1,500 people accessed information on COVID prevention. These statistics are all above the communication industry benchmarks, and this goes to show that when trusted information sources apply reliable technology to distribute their message, real awareness and impact can happen. So we thank PAHO and ITU for working with us, and we do continue, we look forward to continuing to work with them in the future. Thank you very much for listening, and if anyone has any questions, I think there's time at the end. Thank you.
Thank you. Thank you very much, Mr. Corrigan. All right. And you will have an opportunity to ask all of the panelists and presenters questions, members of the media and other attendees. But at this time, I'm going to turn my attention and our attention to the island of Antigua and Barbuda, where we understood from Dr. Cabre that they are Up next, and potentially the first island that will indeed achieve that target. That being said, I would like to invite the Chief Medical Officer, Dr. Rhonda Seeley-Thomas of Antigua and Barbuda, to speak to us on the topic of COVID vaccine rollout and specifically the experience of her island, Antigua and Barbuda. Dr. Thomas Seeley? Sorry, Dr. Seeley-Thomas, over to you.
Good morning, and thank you, Madam Moderator. Let me just say good morning to Dr. Gabriel, other panelists, ministers of health who might be joining us, members of the media. I apologize for Minister Joseph's absence, but as a Minister of Government, you can understand he's very busy. So COVID-19 vaccination is one of the many public health and social measures implemented by the government. And we began in February 2021, and we had 5 vaccines, COVID-19 vaccines, that were made available by the government to the people of Antigua and Barbuda. Part of our strategy included having multiple vaccination sites, and we had up to about 5 vaccination sites at one point in time. But in addition to that, we also had a mobile unit that was deployed to churches, schools, shopping malls, supermarkets, and gas stations. Just in terms of figures, you can see here that as of the 27th of February 2022, we had approximately 61,327 persons fully vaccinated and 2,377 partially vaccinated. What does that mean in terms of coverage? Using WHO's strategy to achieve global COVID-19 vaccination by mid-2022, by September 2021, we had 10% of at least 10% of our population fully vaccinated. By December 2021, we had met the target of 40%. By February 28, 2022, we had 62% of our population fully vaccinated. And we're very, very hopeful, fingers and toes crossed, that by the end of June 2022, we would have had 70% of our population fully vaccinated. What are the reasons for some of the success? Having achieved that would have allowed us to achieve the targets set by WHO. First of all, in terms of governance, we developed a very succinct and detailed national deployment and vaccination plan for COVID-19 vaccines. We also, the Cabinet of Antigua also established a national COVID-19 technical working group that looked at the technical aspects and made recommendations to the government on vaccines, COVID-19 vaccines. And we also had a national coordinating committee that dealt with on-the-ground rollout of the vaccination program. We paid attention to priority groups using WHO's prioritization roadmap, meaning that we focused on those over 60, those with chronic non-communicable diseases, healthcare workers, and those in institutions primarily. We also partnered heavily with the private sector. We used private physicians for them to administer vaccines and to record adverse events. We went out to hotels specifically because we depend very much on tourism, and we realized that the tourism sector was one that we had to focus on. So we actually went to hotels to administer vaccines. And we also partnered with different businesses, the banking community in particular, in administering vaccines. And very importantly, and quite relevant here, is that we use information technology to promote COVID-19 vaccine uptake. Looking closer at information technology, one of the first things we did is that we developed a website specifically for COVID-19 vaccination. And on that website, we actually were able to deliver general information, give education materials, and there was also the opportunity for online registration. But even before we developed our deployment plan, in December of 2020, what we did, we used information technology to have a virtual public consultation and education on COVID-19. There we were able to get experts from Antigua and Barbuda and neighboring territories, and very importantly, PAHO, to first to host a Zoom consultation on COVID-19 vaccines, the facts we revealed. And we have had hundreds of persons, including the media, who tuned into that platform to get information on COVID-19 vaccines. Part of our plan also included the use of information technology, whereby we We used SELMA, which is a modularly constructed healthcare information system that was in use even before COVID-19. But what we did when COVID-19 vaccination came around, we included a module that was used to manage vaccination data. So we had a platform where persons can register, where they could, their vaccination information was actually recorded, where they were vaccinated, what vaccines they got, what doses they received, if they had an adverse event. The software also allowed us to notify persons if they were they had an upcoming appointment for a second dose or for their booster. And this, I think, was very useful for us in terms of getting a database and knowing who exactly would have been vaccinated. And just to show that I did say that we used a mobile unit. We actually had a blood mobile unit that we used, and it's pictured here. We converted that into a COVID-19 vaccination mobile unit, and it's here at a parking lot at a shopping mall, waiting for the team to finish setup and for us to start vaccination. But what I want to also illustrate is that at the mobile vaccination sites, we did have, we used information technology, and you can see members of our team here with their laptops, with their iPads, where they could retrieve registration data on the field and also register persons electronically on the field for those persons who came to one of our mobile sites. So that was a good use, I think, of information technology in our program. In terms of information technology, we were also able to use the IT to conduct an online survey to ascertain healthcare workers' willingness to accept the COVID-19 vaccine. Very early on, we realized that we had to convince our own healthcare workers of the importance of COVID-19 vaccination because they were influencers, and we had to get them vaccinated as well because they were a part of our frontline workers. So this online survey that we used actually assisted us in getting an idea of why healthcare workers didn't want to be vaccinated, what were their thoughts, what were the myths that they had, and we used the results of this survey to tailor our education program for healthcare workers. And I think this was very useful. We use information technology and as well using social media. We had live streaming when healthcare workers, politicians, sports personalities were vaccinated. Here you can see we have the Prime Minister's wife, who's also a Minister of Government, when she was vaccinated. We have Sir Andy Roberts, who's a very famous cricketer, when he got vaccinated. We streamed that live, a member of the West Indies women's cricket team, and a member of the clergy as well. I think this as well helped others to influence them to get vaccinated. When they saw leading members of our community getting vaccinated, I think that they also would have come forward to get vaccinated. We use information technology to target special groups, for example, our youth. We realized that we had a challenge with the population between the ages of 18 to 40 years. So what we did, we had a virtual vaccination party. It was held on a Friday night, and we had very popular artists perform via Zoom. It was streamed live on television via Facebook. And we had a lot of youths actually tuning in and participating in that virtual vaccine party. And the promoters, the entertainers, they were encouraging persons to get vaccinated while they performed. And we also had a drive where we provided gas to persons between the ages of 18 to 40 years. And once they got vaccinated, they were able to get $50 worth of gasoline right on the spot. And that was very well supported by our youth. We use information technology to educate special groups. A flyer here, we had an open forum on a weekly basis for nurses and doctors where they could come forward and get up-to-date information, because information on COVID-19 vaccines was very dynamic. So we use an open forum using the Zoom platform to educate our doctors and nurses. And we had similar for healthcare workers, teachers, parents, particularly when we introduced the Pfizer vaccine for the adolescents between the ages of 12 and 17. We used Zoom to have parent-teachers meetings, and those recordings were kept online for persons who wanted to view them at a later date. We also use information technology to educate hotel workers and management, or banking association, or unions, and members of our employers' federation. We're very proud of our electronic vaccination cards. I have an example here. And it actually gives the person's pertinent information, name, for example, the dose of vaccine that was given and when it was given. But very importantly, there's a code that can be scanned so that if boosters are obtained, that would be recorded electronically, although not recorded on the card. We found that we got a lot of complaints from our residents when they would travel, when other countries had a vaccination mandate, and they would travel with the paper cards. They could not be uploaded electronically. Some persons got their cards damaged. So we decided very early to invest in this electronic card. And we thought that it would help persons, and I think it did. A lot of persons came forward to get vaccinated when other countries insisted that they get vaccinated to travel. And the vaccination card was very convenient. And it was almost a bonus for getting vaccinated. You got vaccinated and you got your card, in short order. Another critical component, not really related to IT, that I think has led to our success so far, the government of Antigua and Barbuda introduced mandatory vaccination for the public sector employees and children over the 12 years of age, and that started in September of 2021. And preliminary data illustrate that we had an uptake, an increase in vaccinations when the mandate was introduced. Other things that led to success, not related to information technology, of course, the efficiency, warmth, and professionalism of our healthcare team, particularly our nurses, and teamwork. Teamwork was really critical. I have a picture here of members of our registration team, our appointment making team. We really worked well together to ensure that we had a good product. And in closing, I just want to thank PAHO for their support. We could not have achieved our success without the support of the Pan American Health Organization. Also, gratitude to the UN agencies, Digicel and ITU. Antigua and Barbuda was very, very happy to be part of this project. And I really want to thank you for all the support you've given us in reaching this stage in our vaccination program. And I think we've been very, very successful. Thank you so much. Bye.
Sealy Thomas. And again, some key lessons learned, the importance of partnership and collaboration, as you heard from Dr. Sealy Thomas, and how much Antigua and Barbuda is leading in that regard. Specifically, she spoke about not only the importance of the use of information technology, but the importance of getting that message out, and again, through the information technology platform. So rest assured, Dr. Sealy Thomas, we join you in crossing our fingers and toes as you and your team continue to drive towards attainment of 70% by June 30th. So I'm sure you're all asking, so what's next? And in that regard, it's my pleasure to invite Dr. Darlene Omer, Family and Community Health Advisor, PAHO-WHO, Office for Barbados, ECC, to share with us a bit more and to give us a bit more of a preview of the new materials and insights, and in essence, what's next. Dr. Omer.
Good morning all, and protocol being established. So yes, what's next? So looking on the next steps, we identified some important aspects. One, the issue related and concerns related to COVID-19 vaccines are very dynamic, meaning that whatever was our concern last month may now be reduced by something else as we learn more about the vaccines and we continue with the vaccine rollout. So we had a discussion and we realized that we have the responsibility to ensure that our public has updated, evidence-based and timely information to facilitate them making informed decisions related to vaccine and COVID-19 vaccines. So to this effect, we agreed that we would move to a second stage of this project. And we will now look at targeting the countries that have the lowest coverage. As you saw from Dr. Gabriel's presentation, we do have 10 countries that we are at risk, but there are some that have even a more risk, and we think that we need to now zoom in on these 4 countries. So the next stage of the project would actually focus on these countries. Now, in terms of how we came up with these messages. We did a rapid assessment, and we looked at the surveys that were out there, the studies that were out there, and we could name some. For example, the CARFA study. We looked at the study that was done by PAHO with healthcare workers. We looked at the country-specific studies as well. So we looked at the one conducted in St. Vincent, and we actually also looked at the one in Antigua and Barbuda as well. And some other countries also had some specific, like Grenada had some specific studies. So we looked at that. But we also looked at social media. We were seeing what were the messages circulating there. And we also went into these radio call-in programs to hear what were the main concerns people were expressing on these programs. And we also looked at the newspaper and everywhere. We even had some focus group discussions to see what were the main concerns at the moment that we now needed to address. And to this effect, we came up with, there was a lot, I must say there was a lot, but there were 5 that were outstanding. There was one looking at COVID-19 vaccines and the variants. There was one looking at young people. Young people had the belief, and understandably, because before we were always saying that the higher risk group was the elderly group, which is true, but young people seemed to believe that they didn't have any risk. So we found that as a concern as well. People were still concerned with their underlying conditions and how to make the decision. There was a strong concern about COVID-19 vaccines and pregnancy. So we also targeted this message, and of course, herd immunity. So what we're going to do now quickly is just to show you a preview of some of these messages that are going to be disseminated. And my colleague Brenda, who worked very hard on this, is going to now present you with those videos. So these videos are uploaded on our website, and we're going to share that with you where you can find them so you could have access to them, and you may use them for your local and national campaigns. But we're also going to share the link with you by email as well, so you could have easily access to it. We also included a section of question and answers, and this section captures the other topics that we were not able to capture in videos, because as I mentioned earlier, we did have a lot of, we found a lot of gaps in information where people needed evidence-based answers. So we included a section on question and answers to address the ones that were not as frequent. And we also had social media cards. We have for Instagram, and of course, for Twitter.
Have you gotten your COVID-19 vaccine yet? I did. I may be young, strong, and healthy, but if I get infected with COVID-19, I could get sick, even critically ill. Across the world, many young people are losing their battle against COVID-19. By getting vaccinated, we protect not only ourselves, but the older family members and friends, whom we mingle with and who can easily become severely ill. My doctors told me the available vaccines are safe. Side effects are generally mild, mainly soreness at the injection site, headache, diarrhea, muscle pain, coughing, and fever. Adverse events are very rare. And the vaccine won't make you unable to have children in the future or affect your reproductive system in any way. Pregnant women too are advised to take the vaccine. We all want to be free to work, play, and enjoy life together once again.
Spread love. Get the shot. Vaccines bring us closer. This is a message from the Pan American Health Organization and the Ministry of Health.
During the COVID-19 pandemic, one of the questions most raised by pregnant women is whether or not they should take the COVID-19 vaccine. If you are pregnant or thinking about becoming pregnant, we advise you to get vaccinated against COVID-19. It has been shown that unvaccinated pregnant women who get COVID-19 are at more risk of developing severe illness that requires hospitalization. Your babies too are also put at risk, including early or premature delivery. And for those mothers who are breastfeeding, you too should get vaccinated. No harm will be done to your child. Vaccines work and save lives. Protect you and your baby, and get vaccinated today.
Spread love. Get the shot. Vaccines bring us closer. This is a message from the Pan American Health Organization and the Ministry of Health.
Just restate what I was sharing. I was saying that we would go into the question and answer segment of the session. And this is where you get to ask your questions based on what has been shared and the information that would have been shared with you via the fact-finding sheets as well. The approach we'll take is we will take questions live first, and I'll alternate those questions with the questions from those of you online. Those of you online, I ask that you please use the raise hand icon, and our administrator would see your hand, open your mic, and your question will be asked. You can also use the chat to share your question. I have line of sight of the chat and I will be monitoring it, and again, we'll alternate. So that we get as many questions asked, I'm asking members of the media to please ask single questions. You may have subsets to your questions, but others, we want to ensure that, we really share and have an opportunity to share. So with that being said, let's open the floor. Oh, lastly, very important point for those of you joining here, if you can please use the mics that are situated on the floor. That way, not only can we hear you in the room, but those joining us virtually can also hear. This is where I say there are prizes for asking questions. What do you think? We'll get some more folks asking questions. All right, let's check online and see. I've not known the media to be shy ever. All right. Not seeing any questions just yet in the chat. And if I can ask you to just identify the media house as well. Thank you so much.
Good morning, I'm Wendy Bird from the CBC here in Barbados. My question is to Dr. Gabriel in terms of the point that you wish to be at in June. Given what the various countries within the Caribbean have been doing, how realistic is it for us to reach that 70%?
Absolutely, Dr. Cabre. Over to you. Thank you, Wendy.
Thank you, Wendy, for the question. Countries have been working on the rollout of vaccine since April 2021. The governments at the highest level of leadership, the ministries of health, and then other healthcare workers at different levels in the system continue to plan. Each country has a plan which was prepared before the vaccines were actually being present in the country. They have refined those country development and rollout plans as the time goes by, looking at the weaknesses they may have, the situation analysis. As you heard from Dr. Celie Thomas about what Antigua has done. Similarly, all countries in the Eastern Caribbean have made adjustment to their plans. The only thing which is now holding back to achieve the 70% is that the recipient of these vaccines, the vaccine hesitancy, as we mentioned, as high as 25%, 30% in some countries, which could be broken into different reasons. The studies done by UNICEF in last fall, by PAHO, by CARVA, indicate what kind of messages have to be given out now, who should be targeted, I don't want to go into the details of those studies, but definitely we know who are those people who need to be reached out. Some of them may not be able to convince them at all. If they are hesitant, by definition, hesitant means people who may decline or refuse to take vaccine despite being the vaccine available. So the information has to continue. We have to educate. It's not only educating, but providing the right message through the right channel, as we have been doing with our partners like Digicel, ITU, and others. So it's a matter of working harder than what we have been doing. Definitely we're going to reach that target if people are receiving the messages appropriately. Thank you.
Thank you. Thank you, Dr. Cabre. All right, I'm not seeing any questions online, so I'm going to come back to our colleagues here live. So while you consider your questions, I'd like to ask a question to the panelists. And if I can ask Mr. Corrigan, what were the most viewed messages over the period? I know you spoke to it indicatively, but can you identify what were the most viewed messages, perchance?
Yeah, for sure. So I hope you can hear me. The most engaged message we had was around myth busting and education content, which is what we were hoping would be the case. So that was essentially people looking to get clarity on actual scientific factual information, as opposed to just more general awareness. So yes, it was very much the myth busting content.
I'm so sorry, but may I ask you to repeat that question? I'm just going to ask our technical team to just give us 1 second. I know I need to come off mic, so you're not going to have that feedback. And Mark, I'm going to ask you to repeat. Thank you so much. Sorry about that. So most viewed message.
Sure. Okay. So the most viewed message we had and the most engaging content we had was around the myth busting content. So that was people looking to find the actual scientific information, which is what we were hoping would be the case, because it goes to show that people do have an appetite to find out what are the experts saying, what are the medical experts in the room saying in a time when there was so much fake news, if you will, online and on social media. So to answer the question, it was the myth busting content was the strongest performing.
Thank you. So just to restate, for those of you who may have had a bit of a challenge hearing, it's about the expert, the scientific, the evidencing of the facts. You know, folks want to have that information. Thank you so much for sharing that. All right, let's see those questions coming in. I hope I didn't put you off by asking to please ask a single question. Wendy, I may have to call you back up. Any other questions, colleagues of the media, participants? We heard that there were a few countries at risk, and I believe Dr. Mayer, you mentioned 10 specifically. So who's up next? I know Dr. Gabriel would have spoken to all of the countries working assiduously to get to that target. Some just naturally are further than others. Do we have a sense of who's up next in terms of, I know we focused on 3, but who are the other islands, perchance? I can ask that of the panelists, probably Mr. Thomas or Dr. Gabriel.
Yeah, so as we look at the Barbados and the Eastern Caribbean, the next one would be Anguilla.
Okay.
Anguilla is very, very close to that target. And then third in the line would probably be St. Kitts and Nevis. Now, what we are seeing is that some countries actually December scale up a bit. So countries like St. Vincent did a lot in December. And if that scale up could be continued, they would probably improve a lot. But as Wendy was saying, it's a really hard challenge, but we have the commitment of the countries. They're doing everything possible. We cannot take down our target. We need to say we're going to push it and get it. But we think the next one that would probably come up would have been Anguilla.
Okay.
Yeah. And I'm not sure if I mentioned earlier, but the 4 countries that we would be targeting with this second stage would be St. Vincent, Grenada, St. Lucia, and Dominica. Over.
Thank you. And that indeed was the next question. I don't know, do you think we're going in alphabetical order? So the A's have it, Antigua and Barbuda, and Anguilla. Barbados maybe next, then? No, St. Vincent, Grenada. All right. Thank you so much, Dr. Omer. Colleagues, your questions, please. Quite a bit of information was shared, and we have to, as media, share that message. Let's ensure that we are negating and mitigating the misinformation. Any additional questions? And I look to you, Wendy.
Thank you, Wendy.
Looking at the videos which PAHO has produced and the fact that we're now back to face in the classroom, are you looking to perhaps link with the ministries of education across the Caribbean to help spread that message through the youth?
Yes, we're actually partnering with UNICEF on that. We're currently developing a campaign to actually safe return back to school. It's a project led by UNICEF, and we're partnering with them and with the Ministry of Education. And of course, in the messages, we do make a call on vaccination as well. In that case, we're also targeting the full Caribbean, because we know most of the countries are now going back to face-to-face school. So definitely, yes. That campaign should be out, if not this week. This week it would be out, that campaign, so you would be seeing those videos.
Thank you, Dr. Omer. Very important. Our children. Sure, absolutely. Dr. Cabre, you'd like to add?
That's a wonderful question about children back to school in person learning. In terms of public health and social measures, which included the so-called lockdown, etc., our principle is that the schools to be the last one to close and the first one to open, and to have as much as possible all the necessary public health measures to continue in schools. Therefore, what governments are doing right now in the Eastern Caribbean, including Barbados, is the right direction. Say that we at PAHO and also with our other partners, we put additional resources for scaling up vaccination programs. As you know, we don't have, which is robustly approved vaccines for children under certain age groups. So we are expecting to have those vaccines available, including for children under the age of 18, which have been approved to be continued and to be available, and to monitor after such vaccines have been administered. One last point when it comes to vaccines, we have a framework for vaccination. Initially, people who are at the higher risk would be to be vaccinated. Elderly, people with higher conditions, health conditions, which may put them at severe illness or death, to be priority. We have almost passed that stage, and vaccines are now available to all who may need it, especially in the Barbados and the Eastern Caribbean countries. So it is the matter of people to come and then to get the vaccines. From time to time, there would be some challenges of certain types may be out, but my understanding is that countries do have at least 3 or 4 different types of vaccines at this point in time. Through COVAX and through PAHO, we are able to provide vaccines. We have a vaccine excess right now, so it's not a matter of vaccine shortage. So we're going to continue. We have resources for these campaigns. We have resources for rollout. As Dr. Omer mentioned, our 4 priority countries are St. Vincent, St. Lucia, Dominica, and Grenada. However, all countries are also our priorities to make sure they reach 70%. We cannot open the economy fully, including schools, including the sport events, etc., unless we have a very good coverage of vaccines. Otherwise, we may also end up having new variants because we don't have appropriately covered the population.
Thank you. Thank you very much, Dr. Gabriel. I think those were very critical points to close off that response. Any other questions?
Marsha, can I just add something? That I need to make a correction.
Yes.
Barbados is way up on the list as well.
Okay.
So Barbados, yeah, if Barbados is, I'm looking at the data for March 4th, and Barbados is probably second, third runner up.
Okay, so the race towards our targets by June 30th.
Yeah.
It's on.
It's on.
Thank you very much for sharing. So if there are no more questions, I would like to say a big thank you to all of our panelists and invited guests. Thank you so much to Dr. Seeley Thomas for those critical lessons learned, and so much that we can do and so much we need to continue to do. Thank you again to the UN agencies, to Transmedia, Digicel for this crucial collaboration that really serves to focus on disseminating practical information about COVID-19 prevention, COVID-19 vaccines, and recommended health safety measures. We have come to the end of our conference. So for those of you joining live and those of you joining online, thank you again for your time. Thank you again for your understanding. We did start a bit late, and sorry for going a tad over, but let's continue to speak about the importance of this very crucial campaign. We look forward to your support in sharing that message. And again, panelists, as we go, any closing comments, remarks? Yes.
Thank you very much, Marsha, for moderating. Let me thank again the media who are here and also online for taking these messages to all who need to hear from us. Let me also thank our UN colleagues and partners, ITU in particular here, and also Digicel. Thank you very much, Mark, for your leadership and then support in this area. We're going to count on you to continue to be our partner in bringing these messages in the next round to all population in the Eastern Caribbean and Barbados. We are happy that we will be able to reach 70%. And then I don't want to call it back to normal, but some resemblance to end this acute stage of the pandemic and then to have our lives back together. Therefore, it is in each of us to make sure we protect ourselves and then reach to our family members, to the message to be out there. The pandemic is not over, but we can end this pandemic by end of this year, before the end of this year. And if we choose to do so, and then working together. Thank you very much.
Thank you very much. And with those closing comments, we say thank you. And this is now the end of our conference. For colleagues who are here at Accra, if you can just stay for one brief second for an announcement. For those of you joining online, enjoy the rest of your day and thanks again.